Assalamualaikum and hello everyone. We are from Group A1. We present on Diabetes Type 1 and Type 2. This is our group members. According to the 2019 National Health and Morbidity Survey, the prevalence of diabetes in Malaysia has risen from 11.25% in 2011, 13.4% in 2015, and 18.3% in 2019. Furthermore, 1 in every 5 adults in Malaysia, or 3.9 million people aged 18 and above, has diabetes, with Negeri Sembilan having the highest prevalence.
Cause of type 1 autoimmune dysfunction of insulin secreting beta cell leading to insulin deficiency. Etiology of type 2, progressive decline in beta cell function associated with insulin resistance in muscle and adipose tissue. Insulin resistance that result in increased hepatic glucose output and reduced utilization of glucose by various organs contributing to hyperglycemia fasting and between meals. Impaired intestinal incretin secretion cause compromised meal-related insulin secretion and glucagon separation, contributing to postprandial hyperglycemia. Excessive renal tubular reabsorption of glucose further contributes to hyperglycemia. Risk factors of diabetes: non-modified, family history, strong genetic components contribute to type 2, but non-modified risk factor can affect it. Twin also affect age, decreased glucose tolerance, insulin sensitivity, and insulin secretion due to aging. Risk factor of diabetes: modified, nutrition, high content of total calories, fat, and carbohydrate dietary intakes, physical, low physical activity, and practice sedentary lifestyle.
The first sign of diabetes mellitus is low level of insulin or less sensitive insulin causes less glucose intake into the surrounding cells, thus no fuel for energy can be used. After that, counter-regulatory hormone increases lipolysis, producing large level of free fatty acid and further decreased insulin sensitivity. After that, free fatty acid is oxidized in liver to form ketone bodies. Acetone is exhaled through lungs and contribute to the fruity or acetone breath. The second sign of diabetes mellitus is slow wound healing. When high blood glucose level is prolonged, it can cause inflammation of the blood vessels, plaque buildup, and thickens blood, thus contributing to slow wound healing. The fourth sign is significant weight loss. When high blood glucose level is present in the body, it will decrease glucose utilization, thus promoting breakdown of adipose tissue into fatty acids. Fatty acids then travel into the liver and undergoes a process called ketosis to make ketone bodies for energy. When this happens in a long period of time, it will cause great weight loss to the patient. There are three major symptoms of diabetes mellitus. First one is polydipsia. When blood glucose level is high in the body, it increases the pressure of the extracellular fluid. Osmosis occurs and water from the interstitial fluid travel to a high concentration gradient that is the extracellular fluid. After that, the body's thirst mechanism are triggered to remind the person to drink water. The second symptom of diabetes mellitus is extreme hunger or polyphagia. The pancreas of diabetic patient only produce small amount of insulin and or the insulin sensitivity is decreased. When this happens, glucose utilization is decreased. Glucose utilization is where the body uses the intake of glucose inside the cell to produce energy. After that, it causes untriggered satiety center responsible for feeling fullness. A chain reaction is caused and feeding center is also not triggered. Due to this reaction, the person feels hungry all the time. The third symptom of diabetes mellitus is nocturia. Diabetic patient has a high blood sugar level circulating their body. When this happens, kidney needs to work harder to filter blood and reabsorbs glucose. At some point, kidney produce more urine to flush out excess glucose to try to regulate homeostasis. When sleeping during the night, kidney can store all the urine and frequent urination happens.
Last but not least, we will look into the complications of diabetes. One of the risky complications is cardiovascular disease, such as heart disease and stroke. High blood sugar can lead to damage of blood vessel and put extra strain on the heart. Diabetes is also a risk factor for peripheral vascular disease, as high blood sugar can cause build-up of plaques in the arteries. This condition can lead to injuries or bruises that does not heal and increasing the risk of infection, consequently leading to amputation. Diabetes can also lead to diabetic neuropathy, in which nerves are damaged, commonly in the legs and feet. This usually causing pain and numbness in the extremities. Diabetic nephropathy is also one of the complications in diabetes. Damaged blood vessels in kidney can compromise kidney filtering system and lead to conditions like chronic kidney disease. Lastly, diabetes can also impact vision, or known as diabetic retinopathy, in which the blood vessels in retina are damaged and can cause blindness. That's all from us. Thank you.